All right, welcome to the elbow scan along video. For the elbow, we're gonna start with our patients just sitting across from us. That's just kind of the way I like to scan the elbow. You could also have your patient laying on the table in supine, and that might give you a little bit more control and over comfort. But for the sake of this, we're just going to scan it with them sitting across from us. During this video, since it's the elbow region, you can even scan your own elbow and practice that way. But we're going to start in this position with the palm kind of up, and we're going to just take the probe. You can put it right into the kind of like the pit of the elbow or just to the distal humerus, either way. And we're going to look for the humerus, deep bony structure here, and then we're going to slide the probe distal until we start to see the appearance of what I like to say kind of looks like a crooked smile. And so this is the distal humerus where it articulates with the humerus, with the ulna and the radius. So this is articular cartilage, this kind of anechoic black line here. And the other structures we're going to look for are the brachialis, which is this very large muscle right in the middle here. And if we come medial, we should be able to find the median nerve here between the brachialis and the pronator muscle. And we can also see the vascular structures. The artery is this large one, and these two are veins. How you can tell by just kind of compressing. You can compress the veins quite easily. And then just moving medial, here you can find the median nerve. Now we come back to home base here, to the crooked smile. We come lateral, and we can find the radial nerve. And once we find the radial nerve, you can kind of visualize this a little bit more proximal, or you can slide distal, and you can see it splits here between the superficial and deep branch. And the deep branch, if we kind of keep moving distal down into the forearm, we'll see this deep portion of the radial nerve dive in between here, the supinator, the two heads of the supinator muscle here and here, and it's right there. And so that's where you can find the deep portion of the radial nerve. And we're going to move back to kind of the crooked smile and the distal humerus, and we're going to start looking at a few deep bones and joint structures. And so we're going to take our probe and move it 90 degrees. And if we come right, here's the distal humerus here. And proximal, if we move a little bit medial, we can find the coronoid fossa, the anterior recess of the elbow here. Right proximal, this is the distal humerus here. And right here is this anterior recess. And this is where we're looking for any kind of fluid to accumulate in the distal elbow. From here, we can also find the distal humeral ulnar joint. So this is the humerus to the left and the ulna to the right. This is the joint capsule over top of it, over top of these structures. And if we move lateral, we can find the humerus again to the left and the radius to the right. And this is the humeral radial joint or radial capitellar joint. This is the joint capsule. Here kind of looks like we call this the seagull sign. Here's some articular cartilage, and here's where we're looking for any kind of fluid to accumulate in the distal, is the elbow joint. If you're looking for the annular ligament, it kind of blends with the joint capsule here, and it can be a little more difficult to visualize over the radial head, but it's about right here. Okay, so after we looked at those structures, we're going to take our probe and kind of come back to the distal humerus, look for the crooked smile again, all right? And we're going to now look at the biceps, and that's going to be right at the top. So here again, this is all brachialis, big muscle right here, and this structure right here, right underneath this little yellow indicator, is the biceps tendon, the distal bicep tendon. If we move our probe more proximally, we'll see some of the muscles start to come in into that tendon right there. And so we can, if you're having a hard time following it, just slide the probe up and down until you start to see those muscles turn into a tendon. If we keep coming down and we're looking for the distal biceps, it can be really difficult to visualize. And the reason is because it dies down between all these different structures, and you have different vessels here and here really are going to obscure the image. And so as we move down, it's going to move and have this anisotropy here. I'm going to come up and down a little bit, and it's going to attach right around here on the radius, and we know that because it's at the area of the supinator here. And so, but it's really difficult to visualize like here, like this. So, but we're going to still kind of look at it a little bit in short axis here, and we're going to take a look at it in long axis. And I'm going to show you a couple other ways you can look at it. So from here, we've moved up towards more tendon right on top of the screen, and we'll remove our probe 90 degrees so we can look at the biceps tendon here. And as you can see, we want to look at it to the right of the screen. You can see this large vessel getting in our way. And so you're going to have to kind of manipulate your probe a little bit by heel toeing the probe, and then maybe even turning it just a little bit, so you can try to keep a good visualization of these fibers here coming deep. And we're trying to get it to the here. And you can see sometimes you're going to have quite a bit of a difficult time visualizing it from here all the way down to this bone right here. You can see I can't really see it too well there as I keep moving the probe, kind of tilting it, heel toeing it slightly. We can kind of see it coming down into the bone here, but it's quite difficult. So there's a couple different ways you can actually look for the distal bicep. If you're having a hard time just looking at anterior, we can look at it from the medial, lateral, and actually a posterior. When we look at it from medial, we'll bend the elbow up around, about 90 degrees or a little less, and we're going to take our probe, kind of put it just in the proximal forearm, and we want to target towards the actual bicep. So don't put it down like this, make sure you're pointed up that way. And from here, change my depth again so you can see it. What we're looking for is this structure right here. You can see a vessel right here almost pulsating. You can see it pulsating, and you see how it's right next to this vessel, which can make it difficult to see, but this is the distal biceps attaching to the radius. Once you're here, you can kind of turn the radius into supination, pronation, kind of visualize the distal portion of the biceps here. But that's how you can visualize that medially. Laterally, we can do the same thing where we put the arm into, about, you can put in just a little bit of flexion, just short of 90 degrees, and we can take our probe and you can put that right over top of the radius here. And here we know, again, we're at the area of the supinator right here. So here's the radius and there's the supinator, and we're looking for this structure deep underneath. So you might need to move the probe into a couple different angles, and then once you find it, you can do the same thing where we move into pronation and supination, so it kind of, you can visualize all of that kind of move in right there. It's right where the arrow is, coming in underneath. And the last way to look at it in the posterior is we take them, the patient have their elbow bent, and we take the wrist and position it into pronation. And this is kind of like almost like a cobra motion. And so as you move in from supination to pronation, what we're looking for is the really the distal end of the biceps. So we're going to take our probe and you're going to put it on the lateral part here of the proximal forearm or proximal radius. And so here we're at this is the radius and this is the ulna right here. And this right here is right here is actually the distal biceps right here. And so it's kind of spatially difficult. If you put them into supination, it tucks away. And as you move into pronation, here it is coming into view. And so that's a great way to really look at the distal portion of the biceps tendon. Keep in mind, if someone tears the biceps tendon, that distal portion could still be intact. So you may want to make sure you visualize, all the biceps. But if they tear it completely, you should see quite a bit of pathology, fluid, and retraction up here in the arm. Okay, so after we've looked at the bicep and all the anterior structures, you could go medial or lateral. We're going to start lateral, and so the elbow is just going to be in again flex position, and we're going to identify the lateral epicondyle, and we're looking for the common extensor tendon. And we're going to take our probe after we've palpated and found that lateral epicondyle, and you're just going to take your probe and put it right on top of it. And as soon as you put it on top, you should be able to see the radial head here. And so it's another good place to look at the radial ulnar joint. And we're looking for right here is the lateral epicondyle, and this is all the extensor tendons coming up and attaching right here to this lateral epicondyle. As it comes in, you see hyperechoic, kind of some vesicular pattern. This is a good, healthy lateral extensor, common extensor tendon right here. Again, also what we can visualize here, you can almost tell it a little bit different right here, is the radial ulnar ligament. Kind of wraps and blends right into this capsule here and wraps around from the radius to the humerus. You can also kind of take a look at that. I also like to look at the common extensor tendon, not just in long axis, but also short. And so we take our probe, we can put it in just 90-degree turn right here. And from here, we can actually see these different structures go, and they are attaching right here. This is the lateral epicondyle in short axis, and coming off of it as I move distal, you can see this is the common extensor, and we see some of the muscles start to come off kind of one by one here. As you can see, a lot of these different muscles converge here and here into this common extensor tendon. So you can kind of visualize for any kind of tears, esophytes, any kind of calcifications, any enlargement of the tendon. You can see a lot of that stuff right there at that tendon. So medially, we're looking at, after we've you looked at the biceps tendon, what we're going to look here is similar to the lateral, we're going to look for the common flexor tendon. And we're going to do the same thing where we're going to find and palpate the medial epicondyle. And so we can find that here with just palpating it. And we're going to take the probe and put it directly on that medial epicondyle here. And so this is the common flexor muscles that become tendon and attaching right here to the medial epicondyle. And we can visualize that as well. Again, you can look at this in long axis, and then similar, again, we can look at it in short axis here, where we can see these different flexor pronator group go from muscle to tendon and attach here in short axis all the way down to the bone. And so you can look at those structures too, in long and short. Also, another structure to make sure we visualize while we're in the medial elbow is the humeral ulnar joint, or the UCL, ulnar collateral ligament. I'm sorry, not joint, the ulnar collateral ligament. And so that's from right here. This is the ulna, right here where my pointer is here. And this is the medial epicondyle here. And so we're looking for this tendon or ligamentous structure here, going from bone to bone, deep to the common flexor tendon. And so this is a little bit of the joint. We're really looking for, you can stress this, and the way I like to stress this is under load, so I would say just don't let me move you. And so we can actually load that structure up, and you can see almost a little fluid moving inside that joint a little bit, but we're really looking for any kind of gapping or separation between this bone and this bone. You can do a couple things here where you actually measure the thickness of the UCL, and you can measure for any separation between these, but you shouldn't really see much of any separation between these bones, no more than 1 millimeter, I'd say. While we're here, the tricky structure we're going to look at is the ulnar nerve. If they can, I like to have them kind of almost sit back, and so we have access right from the medial epicondyle to the olecranon. Okay, so there's two bony structures here and here, and between those two, we're just going to take the probe and put it between those two bones. To the right is the medial epicondyle, and to the left here is the olecranon. Between those, you might see this is muscle tissue here and here, and that's actually, if you slide the probe proximally up the elbow, that's actually part of the triceps. But what we're looking for is this nerve right here, and this is the ulnar nerve. If we slide from medial, it stays right deep to the medial epicondyle. And something I'm actually doing a bad job demonstrating, when you visualize the ulnar nerve, always make sure they're in no more than about 30 degrees of flexion. And the reason is because that they're someone that subluxes, and you can see we can take this elbow, his elbow, move it into full flexion. You can see it stays right in that groove. It does not pop outside the medial epicondyle. And so you want to visualize it about 20-30 degrees of flexion here. You don't want to bend their elbow too far up because they could sublux out. But here we want to visualize the ulnar nerve here, and then slide distal at least 2 centimeters to where it's right here by the 2 flexor carpi ulnaris heads, and we're going to slide a little bit down the forearm for any enlargement of this nerve, and then at the site of the medial epicondyle, make sure you look at the ulnar nerve here as well, and then slide maybe a good 2 centimeters up into the forearm and take a look at the ulnar nerve here. And what we're looking for is any kind of focal enlargement of the ulnar nerve, and you can actually just measure this, take a picture of it, freeze it, and measure around the ulnar nerve, and to get the cross-sectional area and compare that to normative values to determine if someone has ulnar neuropathy at the elbow. All right, so The last area we're going to image in the elbow is the posterior. To do this, we're going to have them take their arm and position it, just kind of in a bent position. If they have any kind of acute trauma to like the, like if you're thinking a triceps tear, and we're going to look at the triceps here, you can have them in a little bit less elbow flexion to whatever they can tolerate. But this is a good way to start here with their elbow flexed. And we're just going to take the probe and put it right on the olecranon here and visualize all the way down to where the triceps tendon attaches onto the olecranon here. And so we're going to visualize all of that in long axis and in short axis here. So again, we come all the way to the olecranon. We can slide up where it's tendon here, and you can see it's going to go from tendon to muscle and all the different portions of the triceps as well. And so you can watch those kind of turn into tendon again. While you're here, the olecranon fossa is deep. It kind of looks like this little smiley face here. We can look for fluid accumulating in this area in both short axis and long. And right here is the olecranon fossa here. We're looking for any kind of fluid accumulating there. This shouldn't be there. Really shouldn't have any fluid there. Good. So that's the posterior. Again, if you want to look at the rest of the triceps, you can slide up in long axis and look at all the different portions of the tricep as well, in both long and short. All right. And that concludes the elbow region. Thank you.